in his address to Congress, President Barack Obama said, "Let there be no doubt, health care reform cannot wait, it must not wait, and it will not wait another year." And that will not wait really depends on us. We're the ones that have to put the wind behind his sails to make it happen.
I consider it my life's work to ensure that my patients have optimal, timely, appropriate, and affordable health care. You might say that I have dedicated my life to winning the fight against cancer and ensuring that quality care is available to all of my patients, all New Yorkers, and hopefully all Americans. Inadequate access to timely, quality health care is one of the greatest barriers of achieving this victory. The failings of the healthcare system directly impact the millions of Americans who are still needlessly, and I underscore needlessly, suffering or even dying because they don't have access to affordable, quality health care.
In the Hudson Valley, however, we do have Hudson River Health Care, and last year we served 50,000 patients, generating 215,000 visits in 14 community health centers. 53% of our patients have absolutely no health insurance. 73% are what we call underinsured because, as we know, Medicaid is not accepted by many of the private physicians in our communities.
I'm really glad to be here today to get all this good information. I've kind of been, most of my life, sort of had big periods of unemployment because I've been in the arts, and so I've lived that kind of like on the edge lifestyle, which is okay when you're young. But as we get older, you know, we've had other issues that come into place as an African American, especially high blood pressure, high cholesterol, you know. That's my family background. And I find myself at a spot now where I don't have the insurance, I don't have the income, and I've not taken my medication in a long time, and I feel like I'm playing Russian roulette.
Hudson River Healthcare is unique in that it's specifically designated to provide primary care to underserved populations. The uninsured are a specific focus of our efforts. When the uninsured do come to our health center, they are often harder to care for than the insured patient. Why? People without insurance generally come to the health center when they're sick. They don't come often for preventative care or primary care or basic checkups. For those with chronic illness, such as hypertension, diabetes, this means that they come at later stages of their disease process. By this time, many of the long-term complications of their illness may have already occurred, complications that possibly could have been prevented if they had had regular health care.
The main hat that I'm wearing here is really as an organizer. You know, Citizen Action does what's called direct action organizing, which we go into communities and organize people called constituents around particular issues like after-school programs, education funding, etc. When it comes to health care, most of us are constituents, not just the people who go to Hudson River Health like Barbara's patients, but also the vast number of underinsured and people who are surprised to find out how little insurance they really have, even in the government program like Medicare.
People of color do not get the same treatment. They do not get the same access or education. They do not get the same advocacy. I can tell you that working for years in the medical insurance arena has really been an experience of learning. And my job in that field was to advocate and to really help the members who have medical insurance, because a lot of times people have their cards in their wallets, but they really don't know what benefits they have. So it was my job to really reach out to the community with that member and train them and educate them. And the one thing that was very prevalent for the most part was the segregation within the insurance business of people that have different types of insurances. The high-level premium gets everything with the shiny car wash, and the very low one where doctors refuse to have them in their offices, or the office is not as shiny, as pretty as the office across town.
I'm Mary Ellen Strabler. I'm a nurse practitioner. after I left Hudson River Healthcare, I now work in the place that has the only group of people that are guaranteed health care in this country. Guaranteed. Would anybody like to guess where I work? The prisons. Absolutely. I work in the prison. Yep. I work at Fishkill Correctional. We have a brand-new regional medical unit, state-of-the-art. I have had several patients who have actually turned down parole to stay in prison so they can get health care. If that is not an indictment of our system, I don't know what is, that you would be willing to give up your freedom and stay in jail.
All is not bad news. I think we have some good news to tell, and that is that our voices are heard. We just have to make sure that we continue to tell the story. So thank you so much.